If you'd like some help with your headaches and migraines, this is the video to watch because we're going through the top medical and non-medical, the latest actually, about treating headache and migraine conditions. G'day, it's Chris Fawcett here from the Headache and Pain Management Centre. It's the 5th video for this week for National Headache and Migraine Week. It's been fantastic talking to everyone right around the world about what it is that I'm very passionate about. And that is the treatment of headache and migraine and what we're able to help. If you are joining us, type in below and say hello. So today we're talking about the treatments, okay? So the latest treatments with headache and migraine conditions. Now we do know that historically when we've talked about treatment, generally the medical profession, they talk a lot about medication. They're talking about the triptan medications in particular. They're talking about, and obviously the over-the-counter medications like Panadol or Nurofen or aspirin, or even opioid medications sometimes you can get stuck into and get sucked into taking way too much of. So today we're talking about a couple of others that, a couple of other ways that we can go about it. So the first way that has been coming out, and you've probably heard a little bit about this one, it's a new medication that is out called Aimovig, or Arenumab, which is the latest in the migraine medication research developed by neurologists to great fanfare in the US a few years ago. Now in Australia, there hasn't been a PBS approval on this one as yet, and it became apparent a few weeks ago why that is. I actually read a wonderful article by my colleague down in Melbourne, Roger O'Toole from Melbourne Headache Centre, who'd done the research and actually done the numbers into this, and it's shown there has been over 10,000 adverse effects in the first year of treatment with this medication. Now, I think there wasn't going to be a lot of side effects to this one, but that couldn't be further from the case. There's actually quite a bit of side effects reported to the FDA from the use of this medication. I'm actually going to link that blog to my page because it is worth reading. I couldn't actually believe the numbers when I read it first, so I actually texted Roger in Melbourne and said, hey, that can't be right. And I actually did my own research on it, and it's absolutely bang on the money. It is, there are some more adverse effects than they first thought. So, you know, it's probably why the PBS hasn't been approved for this drug yet. I will say there have been some patients that it has really worked for, but there are a lot of others clearly where it has had quite a few side effects. So that's probably the most exciting thing that's come across the neurology field in the last little while. However, what I'm more excited about is the discoveries in the non-medicine, non-surgical, non-medication field about how we can treat headache and migraine. Kagi, that's a really good question. I will actually put it in the blog because there are a few and it depends on the different types of patients. So I will put it into the blog. I'll reply to the comment with the link to the blog on there. So when it comes to the non-medical side, so when we're talking about other things, what we're talking about is assessing the top of the neck as the thing to look at. So the top of the neck has been shown to have a lot of nerves and input going into the brainstem, which is the thing that causes the headaches and migraines to happen. So the latest into that is actually doing a couple of things. Firstly is a technique called the Watson headache approach, and it's a wonderful technique that I've been using for many, many years, which is a systematic approach to work out whether or not headaches and migraines firstly originate from the neck, and secondly, if they can be treated. And the way that we do that is by putting gentle pressure on the neck and reproducing the familiar pain of headache and migraine. Now that sounds really scary, I know, but the good news is that if we're able to reproduce it, we can take the pressure off from the thumb and it goes away straight away. But the gold standard to know if you can be helped in this method is if you push on the neck, it reproduces the headache and it reproduces your symptoms, okay? It's usually pain, but there are a couple other symptoms that can be reproduced as well. And as we hold the pressure on there, it gets better, gone. Okay, and if we're able to do that, that tells us that it's coming from your neck, because if we push on the joint, it brings the headache on and it doesn't get better, then it means there's something else sensitizing that system, causing that to happen. So the Watson headache approach is the thing that we use most frequently to do that. Now, what I would warn my viewers about is that the Watson headache approach is very, very good when it's done well, when it's done by skilled people who've been trained in it, that use the techniques every single day. And if you are a person that's used the Watson headache approach before and it hasn't worked for you, then consider the fact that it may actually be user error. Okay, so the person actually conducted conducting the techniques may not be getting the direction right, they may not be getting the pressure right, or they're actually neglecting some other issue that hasn't been diagnosed yet, which I'm going to talk about in a minute. So if you have had the Watson headache approach before and it hasn't worked for you, then I'd consider a second opinion from someone who's done a lot of training in it and also been using the techniques every single day as we have here at the clinic. Well, not here necessarily, but at the clinic, absolutely. The other thing we'd be looking at also are the muscles and strength in the neck as well. So looking at the strength of the deep neck flexors in particular, and also the muscles that go down the back of the neck, which are an issue as well. So a lot of people that have headache and migraine are what are called hypermobile. So they've got a lot more movement in their neck than they should, rather than being stiff. So they actually need to get more strength around the neck, at the top of the neck and down the bottom, and getting their posture a little bit better. So sitting more upright and getting a bit more movement in the front to back direction, so going back that way is going to be important. So they're the two things there. And the third one is something really exciting, and there's a lot of research that's coming out about this, which is developing. We've been doing a little bit here in the clinic as well about how pain actually works in the brain, and how sometimes what your brain can do is can actually be tricked into thinking that there's pain there, or that there's more accurately needing danger to be protected against, when in reality it's actually just a red herring. It's actually a false alarm. And there's a few more videos on my feed all about that if you're more interested. If you are interested, just type in below feed and I'll show you the videos for that. But when it comes to the treatment of headache and migraine conditions, you do have more options than maybe what you think. And some of the non-medical treatments are actually more effective, or as effective, or in conjunction with the medical treatments, effective getting things done. So there are a number of patients that we see that have been through a whole swathe of medications where it hasn't worked, and then when we actually get them with their neck, assessing the neck and actually getting it treated that way, they don't need their medications anymore. And there are different people as well where they're having their medications but it's not working quite as well. You get the neck check, you get that treated, and then the medication actually starts to work. So it's a really individualised approach that needs to be taken when you're treating headache and migraine conditions. It's not one of these things where you can just go in, look at the book and go, oh, you're diagnosed with a headache or a migraine, here's this medication. You've actually got to look at all the things that might be contributing to your headache or migraine condition, which is something that we really pride ourselves on here at the Headache and Pain Management Centre with that. So I hope that's been really helpful, because when we've got that balance right between medical, non-medical, depending on who you are and what your conditions are, you can really get a good result. Now this is really exciting, because I'm hoping that you're staying here, you're still watching. I can see there's a few here. Type in below and say hello. So for this week, it's National Headache and Migraine Week, and we're looking to help as many people as we can with headache and migraine conditions. So if you are interested, we're actually running a small deal until Tuesday next week about getting relief for you and your headaches and migraines. So if you're interested in either, so it's an initial consultation, what it is. So with the initial consultation, what we want to do is we spend an hour with you actually listening to your story, finding out exactly what's going on with your story, how it's affecting you, what you'd like to do, the things that you've tried and haven't worked, and looking to get your headaches and migraines under control. It's an hour-long initial consultation there, and we're doing that until this Tuesday, so over this weekend until Tuesday, for only $59, or gap-free if you have private health insurance. So gap-free if you have private health insurance, or $59 if you do not. So that is out there. You don't have to take it up. You don't need to. It's out there because we want to help as many people as we possibly can. And if you'd like to take advantage of that, just type in relief in the comments below, and that will be a signal for our patient services officer Donna Lee to start a conversation with you to see if you are eligible for our help. We don't want to take you down a garden path or lead you down a path which you haven't been successful before. So we want to see and help as many people as we possibly can. It's there if you'd like it. You don't need to take it up, but if you do, type in relief in the comments, not belief, relief in the comments below, because that will tell us that you'd like some help, and we can just start a conversation over Messenger to see if you'd be eligible for that and if it can actually help you, because hey, this is what we do. I love talking. We've had all sorts of different responses and replies from all over the world this week, and I've been overwhelmed by the number of people that have been talking to me about headache and the help that we've been able to bring just from doing these videos. So I'm hoping that we can help you even further. Good. All right, so it's Friday, so looking to do some other things this afternoon. If you are interested, type in belief. I hope that's been very helpful. Tag, like, share and comment below anyone who you might think may also be beneficial from the information that I've given today. And I hope you have a wonderful weekend, and we'll be back early next week with another Facebook Live video on a different topic that will help all of you out there in cyberspace and on Facebook. Hope that's been helpful, and hope you have a wonderful rest of your Friday and a wonderful weekend. Cheers and bye for now.